Okay, welcome everybody to the second session on the Fab Academy Festival. We're going to be introducing Caroline Yates and Caroline Bestwick, who are going to be talking about the All Health project, Keep Smiling. So I'm going to hand over to you guys. The presentation is all yours. Go for it.
So, we're here today to talk about getting our patients and our colleagues smiling about oral health. So my name's Caroline Yates. I'm a matron from the Royal Wolverhampton Hospital NHS Trust.
And my name's Caroline Bestwick. I'm a dental health specialist from Wolverhampton Special Care Dental Service, also within the Royal Wolverhampton Trust.
So why did we start thinking about oral health within the Trust? So we know that 31% of UK adults have evidence of tooth decay, and approximately 74% of adults require a tooth extraction. Complaints of oral pain in adults equate to over 3 million people, and there is approximately 8,300 new cases of mouth cancer each year. And this month of November is Mouth Cancer Awareness Month. So research has shown that effective oral care for patients is lacking in hospitals. So this is why we wanted to investigate further. Now, the Care Quality Commission in 2014 undertook their review in some of the hospitals in the UK, and they found that patients had very dry mouths, and there was a consensus from staff that they weren't sure where to record that mouth care had been given. So the Care Quality Commissioners brought a statement to ensure a review of mouth care is undertaken so that staff are clear where this should be recorded in the patient's records.
Okay, so a bit of background before we started our project. That a large proportion of the UK population, unfortunately, already had oral health concerns prior to being admitted into hospital. And that impact of hospitalisation can change rapidly for patients as soon as they are admitted, and daily routines can often go out the window. Good oral hygiene is more than just oral health itself. Our mouth is a gateway to the rest of our body, and there's a correlation of general health and oral health that has been found. So the aim of the project was to investigate whether an oral health educational support package for staff, along with a standardised oral health products and patients' oral health risk assessment, will improve oral health care for adults that are hospitalised.
So when we started, we looked at what the situation was within the Royal Wolverhampton Trust, and we found that there was no evidence of a clinical procedure or guidance in place for oral health. There was no evidence of a training package around oral health. The oral health products which were available were not standardised, so there was a lot of variation in different wards. There was no evidence of an oral health risk assessment or a care plan in place. And when we reviewed our audits, our Excellence in Care Weekly audits, it showed that only 17% of patients in the 2-month period had evidence of oral care. As you can see from the graph here, the majority of the responses from our staff was that oral care was not applicable. So we wanted to obviously delve deeper and come up with some solutions around this. So what we did, we set up a multidisciplinary steering group and met each week. We started to use PDSA cycles to trial and test new oral health assessment tool. We looked at products that were around the Trust and the costings around oral health products. And we developed a staff questionnaire to gain some baseline knowledge around what staff thought oral health was like in the organisation and if they'd had any training previously.
So our successes so far, an assessment tool is now embedded in the Trust's risk assessment booklet and is used on all adult inpatient wards, which is RAG rated from red to green, and this is done when on an admission of the patient into hospital to see what state their mouth is when they arrive. Our success number 2 is standardisation of all products which are now being in the Trust and can now be ordered, including a mouth mirror torch, a small headed toothbrush, a denture pot, as lost dentures are often a huge problem within the Trust. We have a moisturiser which will help protect dry mouth, help relieve soreness and helps prevent ulcers. And we have a no foaming toothpaste which will be suitable for patients that have sensory issues or swallowing difficulties. And we also have the ordinary toothpaste within the Trust as well. So we have the Mouth Ease Oral Cleanser, which is good for removing any secretions at the back of a patient's mouth. Again, it is not designed to clean the teeth, it is just to remove any secretions from the mouth. The oral care swab is a single-use item, which this has replaced our pink sponges, and within our Trust we have made the decision to remove all pink sponges, as there was an alert on many years ago. So this has replaced those pink sponges. Again, not suitable for brushing the teeth. It is purely to moisten the mouth and apply the moisture gels. And then we have the denture soap, toothbrush or denture brush, or both if possible, if patients have both got their own teeth and dentures.
So our success number 3, we've put together a couple of things. We started on a Tuesday some online training via Teams, which we called Teeth Training Tuesday, and we've been doing that every week for probably the last 3 months, while we have our online training package developed, which is close to being finished, I'm happy to say. Our Trust have a magazine called Care to Share, and we've had an article in that, and we promoted a competition around the Trust for oral health ward board display, if you can see in the back of this picture here, and we did first, second and third prize, and this is the ward that got the winning prize. Our success number 4 is during Smile Month, we promoted the rollout of our oral health. We managed to secure some charitable funds to make a poster, and we had a couple of days where we were talking to patients and staff who obviously went past our stand to talk to them about the importance of oral health for our patients and obviously for yourselves.
Okay, so moving forward, we have revised the audit questions around oral health, and hopefully in the near future we want to roll out good oral health within our community, paediatrics and midwifery. We are in the process of writing an article and are hoping to get that published within the Nursing Times. And we will continue to carry on the training. As Caroline says, our video is very close to our training package to being finished, and we will continue to support all wards in whichever way they require for their training. So hopefully now we will show you a snippet of our training package. So we'll just try and get that up.
Yeah. Oh, this isn't it. Sorry, that isn't it.
This is it.
The mouth is a gateway to the rest of our body, and the term oral health means far more than just good teeth. Good oral health is essential for our well-being and general health, and oral health can be low on priorities, especially when there are other health issues, and often mouth care is overlooked. Oral health is an integral part of nursing care and not only aids the removal of bacterial plaque, support for dry mouth and denture hygiene, it enhances a patient's ability to eat, drink and communicate. It can reduce hospital-acquired pneumonia and reduces hospital stays.
The Department of Health stated it is essential to support good, regular mouth care for patients in hospitals, as oral health care within hospitals is lacking. The Care and Quality Commissioners undertook an inspection on one UK trust in which patients were found with dry mouths, no record of mouth care given, with limited understanding from staff as to where to document mouth care. Mouthcare Matters initiative proved the need for staff to be trained and have the knowledge of what good mouthcare is, skills to be able to assess the oral cavity and provide mouthcare, the right tools to provide effective mouthcare, and support from doctors and dentistry. A new risk assessment tool for oral health and care plan has been developed in the Trust and is embedded within the risk assessment booklet, as shown here. Firstly, identify if your patient has their own teeth, dentures, or both. The risk assessment is RAG rated, and you are to start from the top and assess each patient area, cognition, dependency level, and then their oral cavity. This is how to undertake an oral assessment. Firstly, look at the lips. Ensure they're not ulcerated, bleeding, swollen, dry or cracked. Then assess the tongue, ensuring it's not ulcerated, cracked, bleeding, coated, dry or blistered. Then look at the cheeks, the palate and the gums. Again, making sure they're not ulcerated, cracked, bleeding, blistered or coated, and there is no food debris or thick secretions. Look at the teeth to ensure they're not broken, they're clean and they have no plaque. And then ensure if a patient has dentures that they were well fitted, no debris, clean and not broken. And then lastly, make sure the patient is not in pain. Following what the RAG rating is on the risk assessment, you would then follow that colour on the care plan. So if your patient scored any of the high risk, you would follow the high risk care plan. Again, for the medium risk, you would follow the amber care plan, and the low risk, you would follow the green care plan.
Encourage patients to clean their own teeth or dentures if they are able to, even by asking them if they've brushed their teeth today. Have they got their own brush and paste? It's always good to encourage patients to bring their own toothbrush and toothpaste from home and get their brush out for them so it reminds them, and ask if they would like any help to brush their teeth. We encourage brushing twice a day, the last thing at night and another time of the day, which is normally morning time for most. Brushing before bed is the best time, as it is important to go to sleep with a clean mouth. Saliva is the body's natural defence mechanism in the fight of dental caries. and during sleep the flow of saliva decreases, so teeth will become more vulnerable at this time. People that have a low saliva flow, in other words a dry mouth, or are taking oral nutritional supplements are at greater risk of dental decay. For patients that need a bit of assistance, stand to the side of them and support the head and support the lower jaw, and always remove any dentures. Use a suitable toothbrush, preferably with a small head. Brush the patient's teeth and gums using tepid water to avoid sensitivity, and the toothpaste should have at least 1400 parts per million of fluoride, which states on the packaging, and a pea-sized amount should always be used. Get the patients to spit out after brushing if they can, so they don't rinse away the fluoride. The residue of the toothpaste will help protect their enamel. If bleeding occurs, spend a little extra time brushing the area to help prevent gum disease. If patients have dentures, brush the denture using a soft toothbrush with liquid soap under warm water, again twice a day. And dentures should be rinsed after every meal to remove any food debris. After cleaning the dentures at night, they should be stored in a named denture pot, such as this one that we have in the trust. This will help them being lost, and often patients wrap the dentures in tissue and placed on the food tray or put them under the pillow, and then they are lost and thrown away. In the morning, the denture should be rinsed and placed back into the mouth. If a patient has both their own teeth and dentures, then ideally 2 separate brushes should be used, and dentures should be removed out of the mouth to clean the patient's own teeth, rather than brushing their teeth with the dentures in the mouth. Lost dentures are a big problem, and it can cause distress to the patients in eating, speaking and socialising. Unfortunately, making new dentures is not a quick fix, and it can take up to 12 weeks, and it's very costly. For some patients, especially with dementia, it can be very challenging, and they may never have new dentures again at all.
Within the Royal Wolverhampton NHS Trust, we have streamlined the oral health products. This is available on an equipment sheet available in all departments. The products we are using within the Royal Wolverhampton Trust are a normal small-headed standard toothbrush, standard toothpaste, and we have a new product, Oral-Leave Mould Ultra Toothpaste. This is a low-foaming toothpaste for patients with swallowing difficulties. We also have the Oral-Leave Moisturising Mouth Gel, which is available. A green foam-headed sponge. This is only to be used for patients who require application of the moisturising gel or just to freshen the mouth up. This is a single-use product, as you can see, should not be left in water and should be thrown away after use. The second new product is our Mouth-Ease stick. This again is a single-use product and has got some soft bristles on it to use at the back of the mouth to get those tough secretions off. Lastly, we need a pen torch to be able to look inside the mouth, and the denture pot to be able to keep our dentures clean and fresh for our patients.
Starting off the questions, what's next?
So we've got plans to roll out to community, paediatrics as well. We've been in touch with our what's his name? Chief Medical Officer, who is interested in rolling it out to doctors, so they're aware, not only nurses. And obviously paediatrics will be hopefully mini mouth care. So that's what the plans are next.
Fabulous. How well is it going getting it embedded in your trust at the moment?
So it's embedded all on all adult inpatient wards. So from the audits currently, we've still only got that one question. They are being changed next month, and the compliance with the risk assessment documentation and care plan and the use of the equipment has been greatly received, and we've seen an increase in obviously patients being assessed. The new questions that come out are a bit more streamlined to the assessment booklet, so we'll be able to measure that hopefully going forward and get some more richer data.
Fabulous. Looking at the questions in the chat, what's the difference between a green sponge and the old pink sponges?
Okay, so the pink sponges used to come in a pack of 5 or 6. There used to be quite a lot within the pack, and they used to just come hundreds at a time, and often they were all fetched out and soaked in orange juice, tea. Obviously pre-COVID, when families were visiting, they would use those on the patients. And if some patients weren't necessarily meant to be having any liquids in the mouth, obviously the families thought they were doing them a good turn. So the green sponges are not for patients to have hold of. They are for staff use only. They are single use in the hope that people will realise they are to be thrown away after use and not be left soaking in liquid, and they are to be used for applying moisturiser, not like I say, for a patient just to suck on for any liquid purpose, if that makes sense.
Hi, can I ask a question?
You can.
Hello, yes.
So what is the hope or the hoped timeline that you're going to try to see it embedded across the wider trust?
Okay, obviously it's not a quick fix. It has took sort of 2.5 years to get to this point so far. Obviously COVID has been in the middle of that. But it's just obviously for sustainability as well. We need to do it the right way to embed it. So obviously we're still supporting staff within our own trust at the moment before we kind of roll out it further. Have you got anything to add on that, Caroline?
No, I agree. It's about sustaining what we've got in the trust, but also behind the scenes, start developing the plans that are to roll out to community and paediatrics. I think it's going to take another 12 to 18 months to get us to that point, but it's small building blocks, as we say.